So, going back to the clinical study, we are seeing a ton of stats and we're bringing back up the clinical study that has been done. So, what kind of made you and your team revive all this data and information?
That's a great question. Science continues to evolve.
Yeah.
And that's one of our core responsibilities as members of the scientific and clinical affairs team. My team is constantly looking at the scientific evidence that is evolved coming out from many different entities, including ourselves. And we're constantly trying to understand what's going on in health.
Hmm.
And one of the trends, although obesity has been an epidemic for a long
Yeah.
time and has been a public health concern, one of the things that we saw was that metabolic health and poor metabolic health was becoming a growing concern. A recent study that was sponsored by the CDC showed that more than 90% of adult Americans are metabolically unhealthy. And so that is what triggered us to look at what does that mean?
Hmm.
Being metabolically unhealthy mean? And that is what triggered us to go back into looking at our clinical study and the evidence that we gathered. As I said, we collected a lot of data.
Hmm.
Until this point, we were very focused on the weight loss aspect of it. But given all of the body composition and other data that we collected, we went back to understand what are the benefits of that weight loss. And that's where going back into the data and looking at the data is what we then learned that we were actually able to see with our comprehensive approach a reduction in visceral fat, otherwise known as the bad fat. And we also know from the existing scientific evidence that too much of that visceral fat is not good for
Hmm.
metabolic health because it contributes to inflammation, it contributes to insulin
Yeah.
resistance or decreases an individual's insulin sensitivity, and it contributes to metabolic dysfunction. So that was some what we saw when we went back into the data was
Hmm.
that we saw a 14% reduction in visceral fat
Yeah.
through our comprehensive approach. The other thing that we learned was that although we saw weight loss with
Hmm.
our comprehensive approach, we saw that that weight loss was predominantly coming from fat loss.
Okay.
So we were able to preserve that lean mass. And lean mass, as I mentioned, is more than 50% of it is made up of muscle,
Hmm.
and that contributes to that active metabolism.
Yeah.
So again, connecting the reduction in the visceral fat, retaining that lean mass and preserving and protecting that healthy muscle, all of those are working together to help support metabolic health. So this is the exciting part, given the bigger issue of metabolic dysfunction
Yeah.
and what individuals are facing, and seeing that our comprehensive program can have an impact in addressing that is one of the reasons why we're talking more about these new data.